When illness strikes, we look to doctors to give us answers. But what if they can't? For these unlucky patients, diagnosis is a mystery. It all began in the fall of 1991, when Kathy Antilla was 8 months pregnant with her third child.
It was about 2 weeks prior to my due date, and the nurse took my blood pressure and called the clinic and said her blood pressure is pretty high.
The next day, Kathy was rushed to the hospital for an emergency C-section.
As soon as Isaac came out, I knew something was wrong because he was really small and his color was poor.
He was just tiny. His head was as big as my fist. He was just skinny. He was just so thin. There was just nothing to him.
He was so little that we couldn't find socks for him to wear, so he had to wear my doll socks.
During the first few months of life, Isaac was constantly getting sick.
About the middle of October, he already had an ear infection. In November, we ended up in the emergency room, another ear infection, and this time too, an upper respiratory infection, probably bronchitis.
Strep throat, ear infections, pneumonia, everything you can think of that children would get, but he'd get them all the time, and he'd get them repeatedly.
But whenever Kathy took Isaac to get checked out, the doctors didn't think that his symptoms were out of the ordinary.
And they'd say, well, his lungs are clear, his ears are clear, go home, contact us in a few days if things aren't better. And a couple days later, we would be in, and then it would be bronchitis, it would be pneumonia, it would be an ear infection. And you just think there's going to be a day where he outgrows it. Like his brother had ear infections, he outgrew them.
But weeks passed, and Isaac didn't outgrow them.
Month after month after month, there was something. There was always something.
If he could go a week without being sick, that was a huge deal.
Finally, when Isaac was 9 months old, Kathy's pediatrician referred her to a pulmonologist.
I said, I have this little baby. All he does is cough. He's been sick almost every month since he's been born. He spits up all the time. And I said, I'm just really frustrated.
After a thorough exam, the pulmonologist diagnosed Isaac with asthma.
So now I'm thinking, yes, it's asthma. That's why he's had bronchitis and pneumonia, and we're going to get this asthma under control, and it's going to be smooth sailing. So every day, morning, noon, and night, we would, hook him up to his nebulizer, and he would have some breathing treatments, which did help the coughing somewhat.
In addition to asthma, the pulmonologist diagnosed Isaac with acid reflux, which he thought was causing the spitting up problem.
The pulmonologist then started having him take some kind of a medication to help with the reflux, and that helped somewhat.
But neither medication was the cure that Kathy and Dan were hoping for.
He still spit up, not as much. He still coughed, not as much, but he still got sick.
My worst fear was that he wasn't going to live very long. Because he was sick all the time. And the body can only take so much, especially a little body like that.
Like Isaac's first year of life, the next 3 were full of ongoing illnesses and frequent trips to the doctor. Then, at age 4, Isaac's vomiting problem became much more serious.
He couldn't even look at food without throwing up. You're sitting at the kitchen table eating, and if he comes and walks by, and maybe the smell or how it looks makes him throw up. He could only eat certain foods, and that was a mystery to me, how somebody could only eat cheese, crackers, peanut butter, and juice, and that's all they would eat.
Every time we went out to eat, we would have to, take the menus and set them up around what we're eating because he would get nauseous at the sight of it.
If this was just acid reflux, it seemed out of control. Isaac's doctor referred him to a gastroenterologist.
The gastroenterologist did an endoscopy where he went down, he scoped down through his mouth, into his throat, into his stomach, and did say, yes, there is, we know there's a reflux problem. Okay, we're going to change his reflux med, and, we'll still do the nebulizers, and this will be it. You know, when he gets a cold, put him on an antibiotic and we're good to go. And he wasn't. He still continued to get sick. Month after month after month.
See, the thing of it is, there were so many things going on with him medically that we didn't know the impact of the one thing versus the other thing. The combination of all that stuff was mind-boggling to me. I didn't understand what was going on.
And neither did Isaac's doctors. The child's condition was so hard to figure out that some experts began to question Kathy's behavior.
Isaac had had some trouble breathing, so was kept overnight at the hospital. We were in the room in the evening. The on-call doctor was making rounds. I said, he's always sick, he's coughs, he's always vomiting. And he said, what do you mean he's always vomiting? And I said, well, he's very sensitive to the types of foods he wants to eat. And he goes, well, what if you make him eat a food? What if you give him something to eat? And I said, he won't eat it. And if he does, he'll gag, he'll throw up, he'll vomit. He, in his dictation, wrote, Isaac would probably not be vomiting so much if Mother would not make such a big deal about it. And that, to me, was so enraging, was infuriating, because Dan and I had dealt with a chronically ill child at this point in time. For almost 5 years, almost 5 years we dealt with it. And I would think that if I was a neurotic parent, or I was making this up, that pulmonologist or the gastroenterologist would have picked up on it by now. And I wasn't a new mom by any means. This was my third child. We'd never gone through anything like this with the other two. I was infuriated.
Doctors could doubt Kathy all they wanted, but no one could deny the fact that Isaac's condition was beginning to seriously affect his development.
I wanted my little brother to go outside and play with me, but when he did, we would start running or playing a game, and he would start coughing or throwing up, and he couldn't keep up with, you know, me or my older brother or other kids his age.
I'd always prided myself in being able to fix and find solutions to things, to problems. A lot of men look at life that way. Oh, this is a problem, I'll fix it. And then Isaac comes along and there's this problem. Well, this isn't like, you know, fixing a door or fixing the car. It was just something that I couldn't fix.
Worried and exasperated, Kathy and Dan decided to try one more doctor. Ear, nose, and throat specialist, Dr. James Sidman.
So I decided the best thing to do would be to put him on a 3-week course of antibiotics by mouth. And when I did see him back, about a month and a half later, he looked great. He had just had the 6 healthiest weeks he had had in many months. His cough had gone away, his ear problems had gone away, he wasn't having the throat burning and stomach aches.
He was doing well for a period of time.
And I was pretty proud of myself.
But after 6 weeks, all the old problems came back.
I was just at wit's end at this point in time.
It was then that Dr. Sidman decided to take a step back and review all of Isaac's medical records.
He looked at them and he went, there's something missing.
At age 2, Isaac had undergone a 2-part test that measures how well the immune system is working. But in Isaac's case, only the first half of the test had been done. Curious, Sidman sent Isaac to an immunologist to be retested.
When I saw them, I could see that they had been passed around, they had been told a lot of things, and I think they've been accused of maybe that they're making up or overreacting to the clinical problems, but Isaac was a very sick boy.
Dr. Shapiro drew Isaac's blood and sent it to the lab. A week later, the results came back, and Shapiro quickly called the Antillas.
He looked at us and he said, I'm going to change his life and your lives because I know what's wrong with your son. And he seemed so sure of himself. It wasn't, I think I know what's wrong with your son. He said, I know what's wrong with your son. I believed him.
He said, Isaac has a primary immune deficiency disease. And the only thing I could say was, do you mean like David, the boy who lived in the bubble?
Kathy was partly right. The boy in the bubble was born without any immune system, but Isaac was only missing certain components of his.
The immune system has many different parts to it, and it's a complex system that interacts with all of the parts. So if you're missing part of your immune system, you have other parts that compensate.
In a healthy child, the immune system produces antibodies that constantly fight off germs. But in Isaac's case, he was only producing some of the antibodies, leaving him vulnerable to the kinds of bacteria that cause colds, bronchitis, earaches, and stomach infections. The technical name for Isaac's condition is Common Variable Immune Deficiency, or CVID. It's extremely rare, and its causes remain a mystery, but the dangers are clear. In advanced cases, patients are prone to a host of life-threatening illnesses. For Isaac, there was only one hope for treatment.
What we decided to do is to give him replacement of antibody from other people that would give him what he can't make.
When I left his office with Kathy and Isaac, and the weight that was lifted off of my shoulders, you know, it was like now hope was genuinely there.
And I wanted to bring the diagnosis to anybody who wouldn't listen and say, see, I knew it. I knew I was right. There was something wrong.
In 1996, at age 5½, Isaac received his first plasma infusion to compensate for his weakened immune system.
As soon as I got the plasma, there was a feeling that I have never had in my entire life. That was the greatest feeling ever. I felt like a normal kid. I felt like I could do anything.
Isaac continued the treatments, and with each one, the improvement was noticeable.
After a few months of the infusion, it was a gorgeous summer day, and I was outside working the yard, and he came outside with some kind of a snack that he had never wanted to eat before. And he sat on this bench, and he swung his little legs, and he goes, "Hey, Mom, Mom." And I look over, and he goes, "Look at me. I'm just like a normal kid now."
The Antillas were thrilled with finally having a diagnosis, but they could not understand why it took so long to get an answer.
We learn when we're young medical students, there's a term that they teach us, which is to be a lumper and not a splitter. And being a splitter means that you find a different diagnosis that explains each symptom. And a lumper tries to lump them under one common diagnosis. So in Isaac's case, we have him being treated for stomach upset by the GI doctors, the intestine doctors, chronic lung infections by the pulmonary doctors, chronic ear and sinus infections by the ear, nose, and throat doctor, but nobody's trying to put it together. And I think that's why the diagnosis was missed. In medicine, it's always better to be a lumper than a splitter.
Today, Isaac gets antibody infusions every 2 weeks and will continue to for the rest of his life. But as far as he's concerned, it is the only reminder that he was once a very sick child.
Dr. Shapiro is the greatest. He is just the best doctor ever. I am just glad that I could get to him by the time I was just 5½. Because today, now, I am active. Whenever it's sunny, I'm outside for like hours on end. I'll come in like for about a couple of hours, and then I'll go back outside again.
He does anything he wants to do. And if he ends up getting sick, he takes an antibiotic, and he's usually better in a matter of days. We can live a normal, happy life. He can do what everyone else does, and so can the rest of our family.